is AT. She's a prime patient that's here for her second visit. She was here back in September, and we're just doing a little interview with her just to kind of talk about her situation, her experience. So AT, can you kind of tell us a little bit about you and what brought you here, and just maybe what you had before you came here and how you're doing now?
Sure. Yeah, so I was in an accident about 4.5 years ago, and it was a bad one. I had pretty much full body injury. Like I had sprained ankles, a damaged chest wall, hurt my neck, head. So I was having all kinds of problems. Those first couple of years I was just healing. Pretty much there wasn't too much anyone could do, and then I'd seen a lot of doctors, a lot of different physical therapists, osteopaths, you name it, I probably saw them. So one of the problems I've been having was my doctors weren't really talking to each other. It's like my vision doctor wasn't really talking to my physical therapist, and I made progress, but it was really challenging. And I kept asking hey, are you sure this isn't my neck? Are you sure this isn't hey, I'm having trouble breathing? And especially with the breathing problem, so many people told me, oh, there's nothing you can do. All that's cartilage, you're just gonna have to be patient. And I really did not like that answer. So anyway, I found Prime, and when I got well enough to come to Nebraska, when I came in here, I was walking with 2 ski poles, and it was like a drunk person, third person video game mode or something, just I couldn't tell where I was in space, really struggling. And they basically shoved me back into my body, so yeah.
Okay. What was different about this process from other things that you kind of went through, or what was some takeaway things that you kind of noticed was different as compared to other previous providers?
Yeah, so the Prime program is really integrated, so your physical therapist is there with you when you're doing the vision stuff. They do the vision exam standing up, which had always been I kept telling my vision doctors that my vision's changing all the time, if I stand up or sit down, and they just thought I didn't know what I was talking about. So here they do. And same with the dental, they come with you to the dentist, checking your teeth sitting and standing up. So just the integration, and they're talking to each other, they're solving the whole body problems, what your breathing does to your teeth, and what your teeth does to your vision, and just all of it together. They match my shoes to my glasses, which is the kind of whole body thing that I really needed.
We get asked this a lot. Can you tell us what these glasses do for you, or what the dental orthotic has done for you, or what changes when you put those orthotics on?
Yeah, so I was having a lot of, not only having trouble telling where I was in space, but a lot of migraines, enormous amount of tension in my body. My muscles are all super tight, really difficult breathing. So when you get it all integrated, and you have the dental splay, and you have the glasses and the shoes, it really allows your body to relax a lot more. So I could start to tell where I was in space. I was sleeping better. The migraines got a lot better. They weren't gone, but they were a lot better. I could breathe better. I actually got color back in my face. When I went back home, people were like, man, you have color back in your face. It was sort of dramatic change on that level.
Okay. Can you tell us a little bit about some things that you weren't able to do back when you first started, some things that you can do now?
Yeah, so before Prime, I was pretty much in a recliner most of the day. I couldn't really walk around too much. I had a lot of trouble getting from place to place. My range of motion was super restricted. Even if I couldn't really reach. And in the months since Prime, and doing the physical therapy exercises and being able to walk and know where I am in space really allowed me to do the physical therapy. So, I can, let's see, in November I think I was able to start blowing up a balloon, which I really, really thought I couldn't do. I even remember arguing with Jason about it. I was like, there's no way I'm going to be able to do this. But he didn't believe me, got me to do it, and I did eventually. I can blow up a balloon now. It's pretty amazing. Took me a couple months. of like, putting in the work. And then I also like, just in the past like 2 months, I was able to get a sweater off over my head on my own. I can like wear something other than button-up shirts, so it's pretty great.
So, what did you anticipate or expect when you came here, and what were your expectations met for when you did come?
Yeah, so I was really anxious. I had had a lot of like pretty poor experiences with doctors. They didn't really know what to do with me. Mostly they just wanted to get me out of their office. I think like a lot of the like balance and dizziness problems, like doctors don't know what to do about it really. Especially when you have like vision problems and range of motion problems, like they just are clueless. So I was nervous to come. I thought like maybe they're not gonna know what to do. Like they're just gonna send me on somewhere. But they didn't, and they knew. They said I was pretty normal. I could handle it. And yeah, they helped me and are still helping me. So. Yeah.
If there was a message or advice that you'd give others about coming to the Prime program, or potential patients that might be interested in looking into coming to Prime, what would you tell them?
I would say do it. Stop like waiting. They can really like help you like figure out the exact thing that you need. Like maybe you think you have an exercise that you think is helping you, but they just know so much on how to tweak things, how to like what exactly it is, and how to like do it in a really effective way. And the integration is so important. Like what shoes you wear do affect what your vision's doing, which affects attention in your body. Same with like the dental splint. Like it just makes everything really manageable. So I would say do it and put in the work. Like just trust the process, and keep looking for your answers. There's always something you can do. Don't believe those doctors that say like, oh, it's just cartilage, oh, it's just this, it's just that. There's nothing you can do. Just live with it. Like there is stuff you can do. So I keep looking.
One last question. You mentioned a process. Treatment's a process, and sometimes things don't always go quite like you always want them to go, but yet you're making progress. Can you kind of elaborate? Just I know you kind of said some things that you weren't able to do, just something simple as putting on a sweater, or raising your arms over your head, or washing your hair, just to tell the others out there that their things do get better, but just kind of elaborate on your situation and how things have evolved over the last 7 months.
Yeah, so I think that it's like you have to always be like looking at the positive things and looking how far you've come, instead of like really dwelling on what you can't still do. And then I think also like when you're having a bad day, there's like a storm, you're in bed, like everything sucks, like it's just to get up, do the exercises like anyway, like even just do like one, like it's gonna make you feel better in the long run. And also like just trust your body that just do the like trust these guys, like do the exercises,
So, all right. Thank you, AT.